Fifth unit, recent trends in medical instrumentation. So under that, you are going to see telemedicine, insulin pump, radiofill, endomicroscopy, brain machine interface, lab on a chip. Okay. So first we are going to see about the radiofill. So radiofill is an instrument that going to transmit or measure by using the radio impulses. So by sending the radio signal, that is radio impulse signal to the body, you will be receiving a or collecting the data from the body through the biosignals. Okay, that is said to be radio fill. Okay, radio fill is used in biotelemetry. So in telemetry, biotelemetry, last unit we had studied no biotelemetry where the patient will be treated in different place. Rather than placing in the hospital, the patient will be in the other location point or other room. Okay, whatever means without visiting the patient in direct by the surgeon or a doctor, he may give or provide the treatment with the help of telemetry system. Okay, that is said to be biotelemetry. So radio pill going to be applied in the biotelemetry technique only, communication only. So it is the transmission of biological signal. So through the radio pill you are going to receive the all parameters from the body. So this will be transferred or transmitted to the doctor or receiver side, whoever it may be. Okay, they will be collecting the all details which is gathered by the radio field by the telemetry system. Okay, telemetry is the system which going to be transmit the biological signal. Okay, so in radio pill, a transducer will be converting the signal to be measured into an electrical form, which can be amplified, digitized so that it is suitable for transmission to other part of the system. That means in the radio field you'll be having transducer. So transducer, what is the use of transducer? Transducer just convert the biosignal into electrical signal. Okay. So suitable electrical signal will be converted and amplified. That will be transmitted to the other parts. Okay. Other part means to the receiver side. Then the methods of communication is usually radio means that and hence called radio telemetry. So with the help of the radio signal only. This radio signal is nothing but radio frequency range will be used for transmitting the signal. That's why it's called as radio telemetry system. So radio frequency number three, 3 to 300 megahertz. That range will be covered. Then other frequent uses are in monitoring patients who have certain conditions which put them at risk. So why we go for radio telemetry system means the patient who requires the frequent treatment or frequent checkup or frequent what to say analysis, that is monitoring. Okay, frequent monitoring is necessary for the patient who will be in the risk. Okay, so in that case you will be applying the radio telemetry system without being in the hospital. Okay, so in these cases it may be necessary to implant the transducer, transmitter and power supply in a single assembly is said to be radio pill. So radio பில்லுங்கிறது it will be covering transducer, transmitter and power supply. Okay, so these components will be available together, all together will be called as a radio pill. So these contain uh, that is transducer, transmitter and power supply will be implanted or by doing some surgery you will be placing the radio pill in your body. Okay, to collect the parameters. Parameter is nothing but you will be collecting the ECG signal or temperature, pulse or blood pressure. So like this you will be collecting the parameter through the biosignal which will be collected by the radio pill. Okay, that biosignal will be converted into electrical signal by the transducer which is present in the radio pill through the telemetry system to the doctor, that is receiver. Okay, who will be doing the treatment on basis of your data collected. The radio pill is either swallowed or introduced surgically. So radio pill going to be penetrated or uh, what to say, you can be penetrate the radio pill in your body through surgery means. Then the radio transmitter is essentially an electronic circuit which produces an alternating current. So transmitter, radio transmitter will be holding oscillator device which will be producing the AC current. Okay, AC signal will be produced by the radio transmitter because there you are going to have a oscillator. So this generates a radio wave which is detected in a corresponding receiver. So in the receiver side, this generated AC signal will be collected. That generated AC signal is nothing but radio signal. Okay, that will be received or detected or collected by the corresponding receiver used in the device. See here, this is the picture of radio pill system. So this is body signal, that is biosignal, which going to be collected by the transducer. So transducer, battery and transmitter is enclosed in a container that is said to be radio pill. Okay, so transducer will convert the biosignal, this body signal, into electrical signal. Okay, this will be transmitted through the transmitter device. So transmitterங்கிறது ஒரு like antenna. Okay, just it will be transmitting the signal which is getting from the transducer. So battery is just to operate or drive the circuit, electronic circuit. This is an electronic circuit. Radio பில்லுங்கிறது electronic circuit. So to drive your radio pill electronic circuit, you need some voltage value. Okay, 5 volt, 3 volt. So that voltage value is provided by the battery. Okay, so and then you will be sending the radio waves to the receiver through the transmitter. So receiverங்கிறதும் என்ன, ஒரு antenna, any receiver device. Okay, so you are having so many antenna types. So in that, any antenna type will be used for connecting the transmitter signal. Okay, so the received signal will be displayed in the receiver display device. So display deviceங்கிறது any monitor device. Okay, மானிட்டராக இருக்கலாம், டிஸ்பிளே மானிட்டராக இருக்கலாம், இல்லை சிஆர்டியாக இருக்கலாம், whatever it means, anything else. Okay, so this is your radio pill system. So the radio pill is capable of measuring various parameters. So radio pill எதுக்காக பாடிக்குள்ள வைக்கிறோம்னா to measure some parameters. So parametersங்கிறது nothing but to it going to be measuring temperature, pH value, enzyme activity, oxygen tension value. So all these measurement will be taken by your radio pill device. So these measurement can be made in associated with the transducer. Pressure can be sensed by using variable inductance. Temperature can be measured by using temperature sensitive transducer. So based on the parameter what we have to measure, you will be selecting the transducer types. So transducer, so transducerங்கிறது என்ன, transducerங்கிறது electrodes தான். So you are having so many electrodes. Okay, the next, telemedicine. Next topic, telemedicine. So telemedicine is the application of telecommunication and computer technology to deliver health care from one location to another location point. Okay, through the telemedicine you will be communicating the patient through the uh, through some technology, that is computer technology. Okay, you will be monitoring the patient by communication. Okay, from one point to another point. He will be in the other location. You will be the treatment provider will be in the other location. So this will be like your telemetry system. Okay. So, in other words, telemedicine involves the use of modern information technology to deliver timely health service to those in need by the electronic transmission of the necessary expertise and information among geographically dispersed parties, including physician and patient, to result in improved patient care and management, resource distribution, efficiency, and potentially cost effectiveness. So, why we go for telemedicine means to provide the timely health service. Okay, so in need of time you will be providing through the telemedicine. Okay, so without meeting the doctor it will be taking time to meet the doctor. Okay, that will to give the treatment it will be taking the time. So for that time consideration, without providing the delay, the treatment will be started with the help of telemedicine. Okay, this is the most advantage of using telemedicine technique in the medical field. Okay, which will give the improved patient care and management, and then resource distribution efficiency. That means that treatment, that is if you want to scan the patient, or if you want to take the parameter analysis, so temperature எவ்வளோ, pressure எவ்வளோ, பிபி எவ்வளோ இருக்கு, சுகர் எவ்வளோ இருக்கு, ஏதாவது செக் பண்ணும் immediately you can do it by uh, using telemedicine service or technology. Okay, immediately. Then teleradiology. Teleradiology means, I think you all know radiology system. So radiology in the X-ray, the CT scan, MRI scan la irukலையா, that will be coming the radiology under radiology. So இந்த இதெல்லாமே என்ன பண்ணலாம், you can be taken, uh, provide the information from one location to another location for the expert. Okay, so now ipo you may be consulting the doctor who will be general. Okay, a general doctor. So he may say that I will be on seeing your report, seeing the CT scan report or MRI scan, X-ray scan report. What he will be saying, I will be discussing with the specialist. Okay, and say you the result, what we can do further treatment அப்படிங்கறத சொல்லுவாங்க இல்லையா. So that consultation will be done by through the telemedicine. Okay, for this purpose only he may, the general doctor may transmit the CT scan, MRI scan through the teleradiology method. Okay, then telepathology. Pathology, what is pathology? Microscopic image. Okay, microscopic image is nothing but through your blood. Okay, through the microscope you will be viewing the image. Your cells will be uh, seen through the structure of the cells will be seen through the microscope. Okay, that study will be called as pathology. So telepathology means from one location to another location you will be sending the microscopic image result. Okay, to the expert for to have a future treatment for the disease. And then telecardiology. Cardiology-நாவே தெரியும், ECG. Okay, echocardiography, that is your heart disease. Basically cardiology-நாவே heart disease, any type of heart disease will be given treatment through the telecardiology method. Okay, tele வந்தாலே from one location to another location. Okay, so cardiology na any heart disease. அதே மாதிரி pathology na by seeing the result of microscopic image you will be getting the treatment through the telecommunication. Okay, then tele-education. So this is tele-education and so now tele-education only you are having no. So teachers in one location, students are in another location. So in the same manner that medical education will be provided through the tele-education method. Okay, so students will be in some other point, lecturer will be in other location point. Okay, so through the telemetry system you will be providing the education. Okay, teleconsultation. So consultation and any special doctor you will be the general doctor then you will be seeing your family doctor. He may not be special in all the disease treatment. Okay, so some specialist doctor will be recommended for the future treatment for the particular device, sorry, disease. Okay, ஸோ அந்த மாதிரி மீனில் யூ நீட் நாட் டு meet your specialist doctor directly. Okay, at that case you will be taking the treatment through the telemedicine technology. Okay, then what are the advantages of telemedicine? So telemedicine can be beneficial to patients living in isolated communities and remote region who can receive care from doctor or a specialist far away without the patient having to travel to visit them. So that this telemedicine technology will be very useful to the patient who are living in the rural area. Sorry, remote areas. Okay, okay, rural areas, remote areas, any isolated communities means any what to say, tribal, trib, tribal communities. Okay, மலையில் இருப்பாங்க, கீழே வந்து தான் டாக்டர் பார்க்கணுன்னு இருக்கும் இல்லையா. ஸோ அந்த மாதிரி சுச்சுவேஷன்லலாம் யூ வில் பி யூஸிங் த டெலிமெடிசின் டெக்னாலஜிஸ். ஓகே, வித்தவுட் எனி traveling to visit your doctors. You will be taking the treatment immediately. So, recent developments in mobile collaboration technology can allow healthcare professionals in multiple locations to share information and discuss patient issues as if they were in the same place. ஸோ ஒரே இடத்துல இருந்தாலும் என்ன பண்ணுறோம் இப்போ nowadays we are taking treatment through the app, mobile apps. Okay, so all the doctors are now using the separate apps for their clinics. Okay, you can have the appointment through that app. Okay, whether he's available or not, everything can be checked through the mobile app. Okay, even though you are in the same area. Then disadvantages of telemedicine. So disadvantage in Patina, major disadvantages, inability to start treatment immediately. Okay. So you can convey the message and also you can receive the message. That means what to say, you can take the pills, this tablet or this medicine you can take right now like that. He or make she may can maybe provided, but அந்த மெடிசின் அவைலபிளாக இருக்கணும் இல்லையா பேஷண்ட்க்கு இமீடியட்டாக. ஸோ தட் இஸ் த டிஸ்அட்வான்டேஜ் ஆஃப் யூஸிங் டெலிமெடிசின் சிஸ்டம். இப்போ பேராசிட்டமால் இந்த மாதிரி மெடிசின்னா இட் வில் பி அவைலபிள் நியர்பை. ஸோ பட் இதே வேறு மாதிரி டேப்லெட்ஸ்னா it cannot be taken immediately. That is the disadvantage, main disadvantages of telemedicine system. For example, a patient suffering from a bacterial infection. Okay, so bacterial infection நாவே என்ன தரணும், antibiotics கொடுத்தாதான் it will be slowing down. Okay, இல்லைன்னா unless it will not be cured. uh, ஆன்டிபயோட்டிக் குடுக்கலன்னா க்யூரே ஆகாது. அந்த மாதிரி கேஸஸ்ல என்ன பண்ணணும்? யூ ஹேவ் டு மீட் த டாக்டர் இம்மீடியட்லி. ஏன்னா அதுல வந்து செக் பண்ணா மட்டும் தான், கம்ப்ளீட்டா செக் பண்ணா மட்டும் பிளட் ட்ரீட்மெண்ட், சாரி பிளட் செக்அப் எல்லாம் பண்ணா மட்டும் தான் they may doctor may give antibiotic to the patient. Okay, so that cannot be provided immediately by the telemedicine. Okay, this is the disadvantage in telemedicine concept. Store and forward. So store and forward is the main concept which is used in the telemedicine system. Okay, so store and forward concept involves compilation and storing of information relating to audio, video, images, and clips, ECG, etc. So store and forward, and you can collect all the information from the patient, like in the audio format or video format or ECG signal, anything else. All the parameters you can be collected and stored. Okay, in the digital form, and this collected details will be sent to the expert means that treatment expert, specialist இருப்பாங்களையா, cancer treatment specialist இருப்பாங்க, kidney can transplantation expert இருப்பாங்க. So for their review you will be sending all the stored information to their for further treatment. Okay, to get the advice from the expert, you will be continuing the treatment. For these cases it will be very useful, the telemedicine technology will be very useful for these purposes, but for immediate treatment it will not be suitable. Okay, so the expert opinion can be transmitted back without any immediate compulsion on the consultant's time during his or her busy professional schedule. Okay, so you can transmit the data to the expert, but the reply cannot be get back immediately. Okay, because the expert may have some other work. You can transmit, but உடனே வருமாங்கிறது it's not necessary. Okay, because he may have some other works, professional schedule, involved in professional schedule. Then real time telemedicine. So real time na தான் என்ன ஆகும், you will be getting the result immediately after transmitting the data to the expert. That is real time telemedicine. So real time telemedicine involves real time exchange of information between the two centers simultaneously and communicating interactively. So real time telemedicine la தான் at the time itself you will be interacting with your expert. Okay, to exchange your information. Okay, it may include video conferencing. You can have a video conferencing, interviewing and examining the patient, transmission of images of various anatomic sites. So anatomic sites in the microscopic view image, Lena, CT scan, MRI scan, other different types of images can be sent. அதுதான் anatomic sites. Okay, auscultation of the heart and lung sound and a continuous review of various images. All this can be done in the real-time telemedicine. Okay, so real time la தான் you will be receiving the uh, reply immediately from the expert. And normally இதுனா you will not be receiving the result immediately. Okay, that means you will not get the advice immediately from the professional heads. So essential parameters of telemedicine, that is primary patient data, patient history, clinical information. So primary patient data na உங்களுக்கு தெரியும், what is the name of the patient, age என்ன, occupation என்ன, what is the sex, female or male, address, telephone number, registration number, everything will come under primary patient data. Then patient history na அவங்களோட personals. Okay, um, personals means அம்மா இருக்காங்களா, அப்பா இருக்காங்களா, எத்தனை பிரதர், எத்தனை சிஸ்டர், அதுக்கப்புறம் டயக்னோஸ்டிக் ரிப்போர்ட்னா இதுக்கு முன்னாடி என்ன ட்ரீட்மெண்ட் எடுத்திருக்காங்க, என்ன மருந்து எடுத்திருக்காங்க, என்னென்ன ப்ராப்ளம் இருந்திருக்கு, என்னென்ன இதுக்கெல்லாம் ட்ரீட்மெண்ட் எடுத்திருக்காங்க, இதெல்லாம் பண்ணலை, ஏற்கனவே சர்ஜரி பண்ணியிருக்காங்களா, இதெல்லாம் கம் அண்டர் டயக்னோஸ்டிக் ரிப்போர்ட்ஸ். ஓகே. And then clinical information. So clinical information is nothing but signs and symptoms or interpretation of data obtained from direct and indirect patient observation. ஸோ அப்சர்வேஷன்னா இப்போ கரண்ட்டாக உன்னோட ஹியூமன் ஹீமோக்ளோபின் எவ்வளோ இருக்குது, சுகர் இருக்கா இல்லையா, சுகர் லெவல் எவ்வளோ இருக்குது, பிபி லெவல் எவ்வளோ இருக்குது, திஸ் வில் பி கம்மிங் அண்டர் த கிளினிக்கல் இன்ஃபர்மேஷன். ஓகே. பேஷண்ட் ஹிஸ்ட்ரிங்கிறது வேற, என்னென்ன ட்ரீட்மெண்ட் எடுத்திருக்காங்க, என்னென்ன பண்ணியிருக்காங்க, சர்ஜரி பண்ணியிருக்காங்களா, என்னென்ன சர்ஜரி பண்ணியிருக்காங்க, அது வந்து பேஷண்ட் ஹிஸ்ட்ரி. கிளினிக்கல் இன்ஃபர்மேஷன்ல கரண்ட்டாக, ஸோ வாட் இஸ் த பெராமீட்டர், டெம்பரேச்சர் எவ்வளோ இருக்குது பேஷண்ட்க்கு, பிபி லெவல் என்ன, சுகர் லெவல் என்ன, இதுதான் கிளினிக்கல் இன்ஃபர்மேஷன். ஓகே. ஸோ இதில் வந்து ரெண்டு அப்சர்வேஷன் இருக்குது, ஒன்று டைரக்ட் அப்சர்வேஷன், இன்னொன்று இன்டைரக்ட் அப்சர்வேஷன். ஸோ டைரக்ட் அப்சர்வேஷன்னா ஹி மே பி சென்ஸ்டு. இப்போ டாக்டர் வந்து டைரக்டா பார்க்கறது, யூசிங் ஸ்டெத்தஸ்கோப் ஹி மே பி செக்கிங் யுவர் வாட் டு சே பல்ஸ் வேல்யூ. ஓகே. அந்த மாதிரி மீன்ஸ்ல வரதெல்லாம் டைரக்ட் அப்சர்வேஷன். ஸோ இன்டைரக்ட் அப்சர்வேஷன் என்ன, த்ரூ த இன்ஸ்ட்ருமெண்ட். டைரக்ட் அப்சர்வேஷன்ங்கிறது த டாக்டர் வில் செக் த்ரூ த ஸ்டெத்தஸ்கோப். ஓகே. டைரக்ட்லி செக்கிங் த பெராமீட்டர், டெம்பரேச்சர் லெவல் செக் பண்றாங்க இல்லையா, அதெல்லாம் வில் கம் அண்டர் த டைரக்ட் அப்சர்வேஷன், பல்ஸ் செக் பண்ணுறதெல்லாம். பட் இன்ஸ்ட்ருமெண்ட் யூஸ் பண்ணி செக் பண்ணுறதெல்லாம் வில் பி கம்மிங் அண்டர் த இன்டைரக்ட் அப்சர்வேஷன். ஸோ உன்னோட சென்சார், டெம்பரேச்சர் சென்சார் யூஸ் பண்ணி டெம்பரேச்சர் செக் பண்ணுறது, அப்புறமேட்டுக்கு பல்ஸ் ரேட்டு செக் பண்ணுறதுக்கு இருக்கு இல்லையா மிஷின், இந்த ஃபிங்கரில் வைப்பாங்களே, தட் வில் பி செக்கிங் த பல்ஸ் ரேட். அண்ட் பிபி செக்கிங், அந்த பெல்ட், அதெல்லாம் யூஸ் பண்ணீங்கன்னா that will be coming under the indirect observations. ஓகே. தொட்டு பார்த்து காய்ச்சல் இருக்கா இல்லையான்னு சொல்றது தான் டைரக்ட் அப்சர்வேஷன். தென் இன்வெஸ்டிகேஷன். ஸோ வாட் இஸ் இன்வெஸ்டிகேஷன்? இன்வெஸ்டிகேஷன்னா அனாலிசிஸ் ரிப்போர்ட். பிளட் டெஸ்ட் எடுக்கணும், டாக்டர் பார்த்துட்டு உடனே பிளட் டெம்பரேச்சர் அதிகமாகிடுச்சுன்னா என்ன பண்ணுவாங்க, ஒரு 2-3 நாளே பார்ப்பாங்க, 4வது நாள் ஃபீவர் இருந்தால் யூ டேக் பிளட் டெஸ்ட் அப்படிங்கிறாங்களா, இல்லைன்னா யூரின் டெஸ்ட் எடுங்கிறாங்க இல்லையா, தட் வில் பி கம்மிங் அண்டர் த இன்வெஸ்டிகேஷன்ஸ். ஓகே. தே வில் பி செக்கிங் த ஆல் டெஸ்ட் வில் பி டேக்கன், அனலைஸ்ட். ஓகே. எவ்ரி செல்ஸ் வில் பி அனலைஸ்ட். And then data and reports. So data and reports na the MRI scan, CT scan, ultrasound. One second.